If you've been having trouble getting a timely appointment to see your primary care provider lately, you are not the only one. Many in Madison are reporting longer wait times, being pushed to see other doctors, or having to go to urgent care instead.
Tahlil Mohideen looked into one alternative to a traditional clinic that's gaining in popularity, and she joins us now with the story. Tahlil?
This alternative model of care doesn't require insurance or a fee per visit. Plus, it allows doctors to spend more time with their patients, but it's not without its limitations. When Dr. Nicole Hemkes heard there was a way she could see 6 to 8 patients a day instead of her usual 20,
I thought, I think that sounds like it would be a really great model for me to operate under.
It's called Direct Patient Care, a system that charges patients a monthly membership fee for primary care as an alternative to costly insurance.
Patients can spend more time with the doctor. Appointments are easier to get. You can wait, 1 or 2 weeks maybe to get an appointment rather than 6 months.
Hemkes says right now, primary care physicians at traditional clinics are being pushed to take on more and more patients, averaging about 2,500 in their pool.
That's why you hear about a lot of doctors getting burnt out and either, retiring early or going part-time. So that, in a way, is also what's kind of pushing more doctors towards this system.
But if more doctors start to take on fewer patients under this model, what happens to the thousands they leave behind?
If I burned out, I wasn't going to see any patients. So would you rather have me seeing 500 patients or no patients?
Dr. Wendy Malaska says the problem isn't the number of patients, but rather an overall shortage of primary care physicians. The burden they carry under traditional healthcare models doesn't encourage recruitment or retention.
Efficiency in practice for me is much better than when I was an employed physician.
Hemkes says because DPC clinics often take care of their own tests and in-office procedures, there may be less need for specialized doctors, and they could then make the switch to primary care.
That would kind of balance itself out.
The direct patient care model evolved from concierge care. It's been popular in other parts of the country for about 15 years or so, but is slowly starting to gain traction in Wisconsin.